really makes me want to cry when I see, a 20-year-old with a full mouth of veneers, because, most of the time you can do things to avoid this, more conservative things. They will have time to do them when they're older. They're going to need to replace these veneers in 20 years time if they're lucky. My approach is to try and do the most conservative approach. Of course, veneers are a great option for patients that have teeth that are too small, teeth that have gaps and you don't want to close the spaces, teeth that have restorations, they don't have a good color or good surface, things like that, where you need to hide these teeth. That's a great option. And, nowadays we have options of doing veneers with very minimal preparation. But in like nice virgin teeth that only need maybe a little bit of alignment and maybe a touch of whitening and a few spots of composite, I think that's the way to go 100%.
Yeah, no, I love hearing that conservative approach. And I know there are two big famous veneer doctors out there in Dubai. But again, honestly, if it were my daughter, I would definitely push the ortho and bleaching for first line
100%.
therapy. And look, I love doing veneers. It's a great restoration, but not everyone's a candidate. And for people listening, just really be careful and get multiple opinions, because just like getting a car, nothing in your mouth is probably gonna last forever. So you're really committing yourself to potentially doing that procedure maybe once, twice, three times. If you're in your 20s, that restoration's got to take you into your 80s and 90s. I mean, people are living so much longer, and just really be aware of what you're committing yourself to. It's an irreversible procedure.